Picture this. You're out with friends enjoying an afternoon of hiking and picnicking around Pinnacle Mountain. You've just recently found out that you're diabetic and still learning all the ins and outs of managing your disease. Suddenly, you start to feel lightheaded. You start sweating, and then you pass out. Your friends call 911, and you wake back up, confused and with a headache in the ER. The ER doctor tells you that your blood sugar dropped dangerously low. And had you not been with your friends when it happened, this story could have ended very differently. According to the Center for Disease Control and Prevention, there were 267,000 ER visits for hyperglycemic crisis and 202,000 ER visits for hypoglycemic crisis in 2020. Each of these emergencies can become life-threatening quickly. I work as a practical nurse in a family medicine setting. For the past 3 years, I've worked closely with patients who have either been recently diagnosed as diabetics or have been diabetics for many years and have not been able to get their blood sugar under control. I've worked with continuous blood glucose monitor companies to educate myself on the use of their devices. By introducing patients to these devices, I have seen improvement in the control of their blood sugar numbers, as well as a decrease in the types of emergencies mentioned previously. Today, I will help you understand the benefits of continuous glucose monitor use by explaining the potential complications of both hyperglycemic and hypoglycemic crisis, describe how the continuous glucose monitor works to prevent these types of events from happening, and finally, give you some statistics showing the effectiveness of continuous glucose monitoring. Let's start by taking a look at the complications that can arise from hyperglycemia and hypoglycemia. What exactly is hyperglycemia and hypoglycemia? To put it simply, hyperglycemia is high blood sugar and hypoglycemia is low blood sugar. In someone with diabetes, it is normal to have a higher blood sugar than normal. But there is a point that it becomes dangerous. Hypoglycemia is less common in someone with diabetes, but becomes dangerous when numbers become too low. According to Healthline.com, hypoglycemia is an emergency if you experience confusion, blurry vision, or seizures. Hyperglycemia is an emergency if you have shortness of breath, confusion, coma, nausea and vomiting, or fruity smelling breath. Many people who have lived with diabetes can't tell when their blood sugar is starting to rise. Their bodies have adjusted to their new normal. On the other hand, most people can tell when their blood sugar is dropping, but depending on how quickly it is dropping, may or may not have time to react to correct it. As shown in the scenario earlier, these symptoms can develop quickly and without warning and give someone very little time to correct. If someone is alone and this happens, it could lead to death. Since we have a better understanding of the severity of the hyperglycemic and hypoglycemic events, let's talk about the continuous glucose monitor and how it works to prevent these extremes from happening. Historically, when someone is diagnosed with diabetes, they're instructed to check their blood sugars multiple times a day with the finger stick blood sugar. These are performed using a lancet, pricking your finger and checking the reading with the glucometer. The continuous glucose monitor has changed the course of blood sugar monitoring. According to clevelandclinic.org, continuous glucose monitoring is wearable technology that tracks your glucose levels over time. It measures the glucose level in the interstitial fluid just under the skin while you're wearing the device. These devices are placed in an inconspicuous location of the body, typically the back of the arm. It takes a reading of your blood sugar every 60 seconds and sends it to either a reader or an app so that the person wearing it has an up-to-date reading of their blood sugar. There are settings that will alarm when the wearer's blood sugar goes above 250 or if it starts to drop below 70. These alarms on the devices are what gives someone a one-up, if you will, on diabetes. By seeing their numbers and having an audible warning, you have time to react by either administering more medications to correct a high or grabbing a snack to correct for a low. Finally, let's take a look at some actual numbers. Does wearing a continuous glucose monitor actually make that big of a difference? As someone who works with patients with diabetes and spends a significant amount of time educating and looking at data, I can personally say I've seen a significant improvement in my patients' ability to control their blood diabetes. But you don't have to take my word for it. In a study done by Abbott, a leader in the continuous glucose monitor industry, patients with type 2 diabetes spent 41% less time in hypoglycemia, or blood sugars less than 70, and 66% of adults experienced a reduction in hospital admissions. While these numbers may not mean much by themselves, for people living with diabetes, this means a better quality of life. They can spend less time worrying about what their blood sugar is doing and more time doing things that they love. Seeing statistics is sometimes the best way to understand how much of an impact something as small as a continuous glucose monitor can make in someone's life. This image up here just explains an A1C, which is the average of 3 months worth of blood sugars with and without a continuous glucose monitor. The gray is without it. The yellow is with wearing a continuous glucose monitor. You have over a 1 point reduction in your A1C. Earlier, our friend ended up losing consciousness and earned himself a trip to the ER. Had he been wearing a continuous glucose monitor, it is possible he would have gotten enough warning that he could have avoided that. Today, I have provided explanation of complications related to hyperglycemia and hypoglycemia, how continuous glucose monitors work to prevent that, and statistics showing the effectiveness of continuous glucose monitoring. As a nurse, I encourage my patients to listen to their body. No one knows it better than you do. Sometimes, even when we listen, there just isn't enough time to react. Continuous glucose monitors are a tool designed to help you live your best life.